Hello, in this video we're going to talk about pregnancy and childbirth, and we're going to begin with childbirth. Childbirth is the process of being born, very basically. We're going to begin with one concept, which is the expected date of delivery, or EDD, which is 280 days after the first day of the last menstrual period, or you can count it as 40 weeks after the first day of the last menstrual period. That is the expected date of delivery. Now, when you want to refer to what a woman or a pregnant woman is expecting, you can say that she is carrying or she is pregnant with, and then the gender of the baby or the number of babies they are going to have. So, for example, she is carrying a boy, or she is pregnant with twins. Childbirth is the moment when the baby is being born, and it is also called the parturition. So that process. Delivery, childbirth, and parturition are synonyms, but we can only use delivery to refer to the technical term of giving birth. So we have two different kinds of delivery. We have spontaneous vaginal delivery, or SVD, and delivered by cesarean section, or the C-section. The spontaneous vaginal delivery is when the baby is born by natural terms, and delivery by cesarean section or C-section is when there's a surgical procedure to open this this part of the body, so the baby is born and well, without having problems. Now, the full-term pregnancy is a pregnancy that has lasted for 9 months, as you already know, or 3 trimesters. When the baby is born before the 3 trimesters, it is called a premature baby or a premature birth. If the baby is born after the 3 trimesters, then it would be called a post-mature baby. On the event that the baby is born dead, then the reasons might be different, but a very common reason is the umbilical cord that is strangling the baby and doesn't allow the baby to breathe or to have the flow of blood or oxygen. Then it is called a stillborn. Still in the sense that it's not moving. So if a baby is born, you would find it as a stillborn. Then there could be also times when the baby is not born, when the fetus does not become a human living being outside of the mother's womb, and it's called a miscarriage. There could be different kinds of miscarriages, well, of abortions, we can say. The miscarriage is a spontaneous abortion. So spontaneous abortion in the sense that they didn't expect the baby to be miscarried. Then an abortion that is induced, that is a terminated pregnancy or the termination of pregnancy, but this is because of the decision of the mother or the parents. Then talking about the labor is a synonym of childbirth. It's the process of giving birth. We have also some collocations, some words that we can use to describe the labor. We have premature labor, prolonged labor, spontaneous labor, and induced labor, and also false labor. Premature, very simple, it happened before expected. Prolonged, it lasted longer than expected. Spontaneous, it was unexpected. Induced, it was provoked by maybe by the doctor, but it's because it may be better for the baby to be born at that stage and not later. False labor is when the symptoms seem to be showing that the baby is going to be born, but it isn't. So it's just like a false alarm. That's a false labor. Now, talking about the presentation and lie, Presentation is well, presentation and lie are two different concepts related to the position of the fetus inside the mom's womb. Well, let's begin with the fetal lie. Fetal lie is the position of the fetus in the uterus. So it could be longitudinal, which is the normal lie of the fetus, or transverse, which is the abnormal lie of the fetus in the mom's womb or the mom's uterus. Now, the fetal presentation that refers to the part of the fetus which occupies the center of the pelvic canal and which the examining finger feels on vaginal examination or the butterworth examination. So, if what you feel or on the examination is the head, then that is called the vertex presentation, which is the normal fetal presentation, and the best fetal presentation for the baby to be born without any problems. Then the bridge presentation is when the buttocks of the baby are the first thing that you can feel or see on examination. And it is also, well, it is called bridge because in the past, bridge was another word used for buttocks. In the case of bridge presentation, or if the fetus has a position that is not optimal, then there may be the need for the use of obstetric forceps, which, as you can see from the picture and from what you already know, it's this instrument. Okay. Well, that's all for this topic, pregnancy and childbirth. Please go to the Schoology platform and do the quiz. So see you next video. Hello, and well, this is the last topic of this course. It is the respiratory system. We're going to see two aspects. One of them is cough, which is a very common symptom of many illnesses, and the auscultation, which is the process of the examination in which you listen to the respiratory system. So, cough, well, as we said before, is a very common symptom of the upper respiratory tract infections. Okay? And also it's a symptom of a lung disease. Now, what kinds of cough can there be? Well, there could be productive or non-productive cough. Productive, also called loose cough, and non-productive, also called dry cough. Now, the productive cough is, well, the characteristic of productive cough is the production of sputum or phlegm. Okay? So you identify the word phlegm from the, well, for the similar pronunciation that it has with the word in Spanish, phlegm. Okay, now the sputum or phlegm can be can present different colors, or if there are different substances in it. It could be clear or white, and it would be called mucoid phlegm or mucoid sputum. It could be yellow, like with pus, or purulent. That's what the yellow color implies. And also it could be blood stained, like in hemoptysis. Sorry. So these are different kinds of cough and different kinds of phlegms. Now, this is an interaction between a patient and a doctor that in which they are talking about his health problems. So you to read with me. So it says, how long have you had the cough? Mr. Hamilton says, oh, for years. Do you smoke? I used to smoke heavily, but I gave up a year ago. Do you cough up any phlegm? Yes. What color is it? Usually yellow. Have you ever noticed any blood in it? No. Any problems with your breathing? Yes, I get very short of breath. I have to stop halfway up the stairs to get my breath back. Okay? And these are some of the notes that the doctor writes. CO, remember, is complaining of dyspnea and cough, which is purulent, and sputum for years. No hemoptysis. Okay? So now the keywords here that we have are smoke heavily, which could say that it's a heavy smoker. Give up is when they stop doing something. So he gave up a year ago. Cough up, phlegm. In this case, it's to produce the phlegm. By using the word up, then you can say cough up phlegm or producing phlegm. Notice is to see that something is present. So notice any blood is if he saw any blood in the cough. And well, problems with your breathing, I think it's pretty clear. And to get my breath back is to recover the ability to breathe properly. Now, let's continue with the auscultation process. The auscultation process, remember, is when you listen to the patient breathing with your stethoscope. What you would say the patient to do is something like this: take deep breaths in and out through your mouth. Okay? So that's what they would do. Then you would ask them to say 99. I know that in Spanish we have a different number. That's most of the times irrelevant. What you want them to do is to say something that you can identify, or that the sounds that are, or the effort in the lungs can be identified as having problems or not. So in the auscultation process, which is listening to the patient's respiratory system with your stethoscope, you can listen to crackles. Crackles is the word that we use to describe a sound like hairs being rubbed together that could suggest the presence of fluid in the lungs. Okay, so crackles that sound like of hairs being rubbed that can imply the presence of fluid in the lungs. Wheezes, that's a more musical sound. It's like whistling. Okay, and it indicates the narrowing of the airways. So when they become more narrowed, that is, they produce a sound like wheezing, and that could be a symptom of asthma, which is also called wheeze when patients with asthma breathe. Now, when you ask the patient to say something, like in this case 99, is because you want to listen to the sound of the pleural surfaces, if they are inflamed or not. If they are inflamed, they are called pleural rub. Okay? If the resonance is increased, it may be a sign of pneumonia. If the resonance is decreased, it would be a sign of pneumothorax. Okay? So according to this doctor, what she wrote is OE chest, which is on examination, chest, early inspiratory crackles, both lung bases, plus expiratory wheeze. Okay, so basically she listened to crackles and wheezes. Okay, so the sound that was like rubbing hair, and also the musical sound like a wheezing, that is what she heard on expiration. So please take these keywords into account when answering the quizzes. You can go back to the videos anytime, because The quizzes ask you to complete some sentences or some cases that make sense according to what we see in each of the videos. Okay, so please, I hope that you have enjoyed the course and that you can learn a lot from it. Thank you and see you soon.